Dr. Kim Dupree-Jones. I'm a researcher here in the School of Nursing. I study fibromyalgia and MECFS when those coexist together. I've done that for about 25 years now. Most of my career has been at Oregon Health and Science University in Portland, Oregon. And so I come here and I meet Dr. Unger. It's just like today I feel like is going to be a great day for us to get together and figure out how we're going to really leverage this amazing work that's being done here at Emory and the CDC and what our colleagues from Oregon have brought. It's just amazing how much has changed just during my career in terms of the recognition and the reality that these are true medical conditions, that Social Security and disability, FDA indicated drugs now for fibromyalgia, and globally the way that these are recognized now that they were not recognized earlier in our career. Would you agree with that? So I just want to really thank you guys for being here. One of the great things of being part of an academic health center and having the CDC, sharing a campus is there's always research going on. So, research is wonderful sometimes because it helps you, but it's wonderful because it helps the people coming behind you, your kids, your grandkids, because the way we make progress in these illnesses is to have you help us figure out what we need to study next. And so I have two study flyers over on this table, and I'll bring them around if you didn't happen to get them. One is about migraines, and I don't know how many of you have chronic headaches, but people with pain often have multiple pain problems. Chronic headaches, irritable bowel, irritable bladder, restless leg, jaw pain, plantar fasciitis, just as lots of chronic pain syndromes tend to run together. So that's one study. And another study is about how we're using quantitative sensory testing to really differentiate sensation from pain. And why is that important? And how might that help us find better targets for our therapies? So anybody that wants to be in any of our studies, we're always happy to have you. Thank you to the students and faculty that are here, but mostly thank you to Dr. Unger and the amazing group of people that you've brought. So please come get us started.
Thank you so much. It is, we have looked forward to this day. Actually, it kind of got started around the time that this picture was taken. And this is a picture that was taken in May on International MECFS Awareness Day, when our Georgia MEAction colleagues joined many of our CDC program in recognizing that day. And later in the evening, that building turned a little bit blue. And I thank Georgia MEAction for their support of this. We would not have this without them. And it is, I know, a great effort for them to be here. I'm going to give a little introduction to MECFS, myalgic encephalomyelitis chronic fatigue syndrome. And it is a serious long-term multi-system illness and post-exertional malaise, that is the worsening of symptoms after a previously tolerated physical or mental activity is a hallmark. The illness can persist for years, leading to poor quality of life and sometimes total disabilities. And about 1 in 4 patients with MECFS are bed or housebound for long periods of time. Patients are often not believed by healthcare providers, and the lack of a known pathogen and diagnostic test contributes to this stigma. In 2015, the Institute of Medicine did a review of this condition. The book is called Beyond Myalgic Encephalomyelitis Chronic Fatigue Syndrome, and it is available online. It's free if you download it. And they came up with a diagnostic criteria with the hopes of increasing clinicians' ability to recognize this illness. And they actually have 4 criteria. We can have a substantial reduction in impairment ability to engage in pre-illness levels of activity that's accompanied by fatigue, post-exertional malaise, and unrefreshing sleep, and then either cognitive impairment or orthostatic intolerance. And that's just the beginning, because every patient CFS has their own constellation of symptoms, and there's many more.
As many as 3.3 million Americans have
CFS, but many have not been diagnosed. Most have been ill longer than 5 years, but only about 50% still seek medical care.
and basically anybody can get MECFS.
Highest prevalence of this illness is in 40 to 50-year-olds, but children and adolescents are affected. In adults, it's 3 to 4 times more common in women than men, and there is a suggestion of a higher burden in minority and socioeconomically disadvantaged populations. We now are
Thinking of MECFS as an infection-associated
chronic condition. And
there is no one pathogen that's recognized, but long COVID has really brought attention to this. And to enact some consideration of long COVID, what was the definition that should be used?
long COVID clearly includes MECFS as one of the diagnosable conditions
that results from long COVID. But in addition to infectious risk factors, there are non-infectious factors that play a role, and these are stressors such as physical trauma, surgery, unusual stress, allostatic load, genetics,
environmental toxins.
All of this creates a very complicated picture that we have to admit we just don't understand fully.
The diagnosis does rely on the symptom profile and the clinical history, and it follows the 2015 diagnostic criteria.
And there are many objective biologic abnormalities that research has shown
For MECFS, but none of these are specific or sensitive enough to be used as a diagnostic test.
And post-exertional malaise is really the
Key feature. But this requires probing, because a patient isn't going to come into the office saying, I have post-exertional malaise. You have to understand what that is, you have to understand how to ask the questions, and the IOM report really has a nice section on how to
probe to actually elicit the history. And while there are approved drugs for fibromyalgia, there are no approved drugs with MECFS as an indication, but there are drugs that can be used for symptomatic management.
And it is very clear that empathetic supportive care is suffering. So there is a lot that healthcare providers can do. Now,
what I gave you is just the facts. And
you really
don't get the full picture of the illness
until you listen to the patients and their caregivers. And that's absolutely essential. And today, we have the pleasure of having 3 panel members
from Georgia MEAction present.
We have Jes Gordon, who is a patient herself. We have Nathan Lee, who's presenting on behalf of Aaron Lee, who is too ill to present, and Andrew Sweeney presenting on behalf of Corey Anderson Sweeney, who is here,
but also not well enough to present.
And so, without further ado, I think I'd like to turn it over to Jes.
Okay, can you hear me now? I know I can't talk loud enough to anyways. So, yeah, that's a bunch of pictures of me and my family. You know, I had health issues as a child, and this might sound random, and then in 2000, I was in a car accident that left me with pretty terrible whiplash. You know, I'm a wife and a mother and a friend, and before I was sick with ME, I was a busy artist and homeschool teacher, yoga enthusiast. I was doing yoga daily with a group of people in my community. I was stupidly, now I know it's stupidly, doing headstands. And the reason why I know that's stupid is because I had craniocervical instability and I didn't know it at the time. So when I got shingles in July of 2014, I never got better. So, you know, a lot of people can come into this from COVID or from an EBV virus or all these things. But for me, I got shingles and I never got better. And still, when I get crashed, I still have the pain. It comes back in that same spot. So what that means, I have pain. That's what happens. I was diagnosed in September of 2015 because of what Dr. Unger was talking about, because the IOM report came out and it was on the cover of some medical journal, and the rheumatologist my doctor sent me to said, "I think you have this," and he held up the magazine, and that's how I got diagnosed. So I was lucky. I was sick for about a year and 3 months before I was diagnosed. So I'm one of the fortunate ones, because I know people who go decades without a diagnosis. They're just sick all the time and struggling, and they don't know why. And I learned, so I was lucky enough to get hooked up with MEAction early when it was first starting, and when Jennifer Brea was making a documentary about her condition, MECFS, and she was bringing people along, and Millions Missing first started, this t-shirt that I'm wearing, and people in red, you see, it was trying to show people that there are millions of dollars missing from this in research dollars. There's millions of people missing from their lives. There's millions of patients there's millions of doctors who are missing to treat these patients. And I'll explain what I had to go through in just a second. When Jennifer Brea had in a surgery, she wound up developing the inability to hold her neck up and sit up straight at all. And she discovered that she had cranial cervical instability. Now that's typically, you might have heard of that, like when someone's in a major car accident, right? And their skull is not attached to their spinal cord, and it's an emergent situation, they have to do that surgery. Well, there's people who have a lesser extreme of that, where, here I wrote it down. The central idea is that the mechanical deformation of the brainstem due to CCI or other underlying structural conditions can account for the dysfunction seen in MECFS, dysautonomia, immune system dysregulation, viral persistence, post-exertion malaise, and others. So that's what was happening to me, and I was lucky enough to watch Jennifer Brea. So when this was happening, I was doing 2 bags of saline every day, in order to just, because if I went to the bathroom, my heart rate was 180. If I was taking a shower, I didn't even want to check, because my heart rate would get so high. So, the saline was helping me to just survive. I was bedbound, I was wheelchair bound, I couldn't leave the house more than just for doctor's offices. I did not have a life. I was missing from my life. And then there are only a handful of doctors in the US who treat people with ME and people with hypermobile EDS for CCI. And I was lucky enough to go to South Carolina to see Dr. Patel. So there's nobody here in Atlanta. We live in at Emory's here. I mean, there's medical schools here. Why don't we have a doctor here who can treat this? But there isn't anybody. So I had to go all the way to Charleston to see Dr. Patel. And I had surgery in March of 2021. Now, is my ME gone? No, it's not gone. But I'm not wheelchair bound. I went to a concert on Sunday night. Y'all, I mean, that was really exciting. And I walked up the steps to Eddie's attic. I mean, I know people at home aren't gonna know what that means, but there's a lot of steps to get to Eddie's attic. And because they have a historical thing, they don't have to have an elevator. Anyway, that's another story. So it's not accessible. I walked up all those stairs, and I'm doing like 3 bags of saline a week, not a bag of 2 bags every day. That's a lot less, like it really dramatically improved my life. And I recently got over COVID again, and I was terrified the entire time. Every time I get a cold, every time I get a virus, I'm terrified of going back. I know how bad it can get. I know what it can look like. Every time any of my loved ones sitting right over there get a cold, I'm holding my breath until they get better. We never know what's gonna make the straw that broke the camel's back and turn somebody who just had a virus with COVID, or EDB, or shingles, or whatever it might be, any of those things, turn that into a lifelong of disability. I still can't work. I'm able to enjoy life more. My life got better, but it's not better. And yes, there are FDA-approved treatments for fibromyalgia, but we don't have anything. MECFS has nothing. Let me say that again. We have no approved treatments. I know people who have been advocating for MECFS for 40 years. Some of my friends friends who have been sick for 40 or 30 years are too sick to be here today. They're too sick, they're at home, and they probably can't even watch this video because the video will be too hard for them. Screens are too difficult. I guess what I want nurses to know is that you can make people with ME more comfortable in your doctor's offices. You can make sure that there's a place to lay down so that they don't have to sit up in the waiting room. You can make sure that the lights are turned down. You can make sure that there's earplugs available if they need to. Turn off all of the beeping things. No beeping things for people with ME. There's so many things that can be done to just make it a little, and believe them when they tell you that this isn't just your normal fatigue. They're not just tired. They can't pick their head up off the pillow. That's a big difference. Dragging to the doctor's office is gonna crash them. I just want people to understand what a big deal it is. I know people, the only time that they leave their house in months is to go to a doctor's office, and then they're recovering for the next 6 months. That's unacceptable, and that's where we are. And we've known about this illness. Dr. Unger's been working on this for years. I mean, it is time to make a difference. And with all of the people who have added to our numbers because of long COVID, we need help. We need people to know about MECFS and to treat us. Okay, I'm sorry, I totally went off on a tangent. Okay.
Absolutely perfect.
I think that's all I have to say. So thank you for having us and thank you for having me.
Nathan, I'm really glad to be able to be my wife's voice today, and I really wish that she was here to tell her own story, because public speaking and educating is really where she shines. She wanted to be here today. And I'll be looking down at some notes, make sure I get everything correct. But Erin's story with Emmy starts when she is 16 years old. She was running track in high school, and most people get stronger faster throughout the year. She was getting bored, she was struggling, it didn't make sense. And she kept deteriorating. The post-exertional malaise, the brain fog, headaches, cold, dizziness, these myriad of symptoms just goes on and on. It got to a point where she couldn't go to school anymore for a regular day. The school district didn't really know what to do. They didn't know how to handle a 16-year-old girl that was telling them, I can't do schoolwork, I can't do these things. So she ended up going to a school for, what do they say? School for people with disciplinary issues, essentially. She was an A+ student, never got in trouble in her life, but that's all they could figure to do. So she did half days there and graduated, top of her class. But the doctors didn't really know what to make of it either. She bounced around to a lot of specialists, and this is 2003, 2004, 2005, so 20 years ago. She was diagnosed with fibromyalgia, functional movement disorder. Each doctor had a different diagnosis, none of them quite right. The most frustrating thing is that some doctors just didn't believe her. They thought she was attention seeking. She was just depressed. It wasn't real, or the issue was all in her head. And just imagine your house is on fire and you run out of your house and you call the fire department, the people who are supposed to help, and say, my house is on fire, and their response is, what are you talking about? There are no flames. Flames are in your head. That's essentially what was going on. She was bedbound and in a wheelchair for most of 2008. And she really thought she was going to die at that time, because when you deteriorate like that, what do you think the next logical step is? It's death. And that was really a terrifying moment for her. But she was able to recover slowly. And sometimes in this illness, you have moments, stretches, years, decades where you're bedbound like this, and sometimes you can get better. And That's what happens. And so by 2010, when we met, she was fairly mild. You know, she wasn't the same level of ability that she had been prior to all this, but she was well enough to meet me. And fast forward to 2017, we're married, we're traveling, we're hiking. This picture was taken in Banff, a trail high up in the Canadian Rockies. This is what we love doing. Fast forward to, then in 2020, January 2020, she got a mystery respiratory illness. The timing's suspicious, right? That's right around COVID. We don't know it was COVID. This was way before anyone was testing for that kind of thing. It was also pretty early in COVID being in the US, but it was a bad respiratory virus. She just didn't quite recover. She had already been declining a little bit, and then that really set it off. And she started deteriorating again. She couldn't keep up with work, job that she left. She was a manager in an education technology company, and had to take 4 months of leave, essentially. And then when the leave was up, she went back to part-time. By part-time, I mean like 1 hour a day. And that was too much. So she had to give up her career. Even though she's at this point, she is not able to work, she's considered moderate. And on the scale, there's moderate and severe, I forget the exact word, like extremely severe or something. Like, it is wild how much worse you can get this illness. But by 2022, miracle of miracles, Daisy Fiona. So interesting thing about pregnancy, it actually helped with some of her symptoms, probably because of the blood volume boost and hormones and that kind of thing. But then, of course, you know, motherhood comes with its own challenges and demands, and she started to deteriorate again. Interestingly, though, she had a pregnancy complication. The twins were born 3 months early. Long story short, there, because she had a complication, she was supposed to follow up with a cardiologist after the girls were born. She follows up with a cardiologist at Emory, an Emory cardiologist, Emory Midtown. She says, "Oh, I see you have POTS on your chart. Have anyone treating that?" And she's like, no one treats POTS. Half the doctors don't even know what POTS is. And so he said, "Oh, actually, I have a colleague who treats POTS, so we can get you in there." And so, through that silver lining, she's prescribed some POTS medications and trying different things, and it starts to work to get her to increase her baseline. So she's still not where she was, but then again, the ups and downs, the valleys, and you know, the roller coaster. Present day, she's just coming out of almost a 3-month crash. Crash meaning, you know, a period of time where it's post-exertional malaise. You have a long crash where she was basically bedbound mostly. It's just starting to feel a little bit better. So that's Erin's story in 5 minutes or so. But I wanted to press upon you what Erin has learned during this, and I obviously got her thoughts on all this. The larger medical community is not familiar enough with MECFS as we should be. And this is from an advocacy, education event. Erin is second left there. See some familiar faces from our attendees as well, presenters. The doctors were dismissive of her, and if they had known what to look out for, you know, they might have gotten her help a lot sooner. She might have known not to press herself. If you have ME, try to work your way out of it, like, I'll just work through it, it actually makes it worse. If you know to look out for that in the beginning, you can save yourself a lot of difficulty later. Graded exercise therapy doesn't work for ME. Another thing she learned is that the world tends to shrink when you have any friends and family are hard to keep around. When you're not available to go to parties, people stop inviting you to things. People stop checking in. Some people won't believe you're sick. Some people think you're dramatic. You know, like, the world really does shrink, especially when you're in your bedroom and you're bedbound. So the CDC estimates up to 3.3 million people. Dr. Unger showed you that slide. Each new case of COVID presents a chance of long COVID, which is a chance at MECFS. So, think about how many times you've had COVID in the last 4 years, or your loved ones have had COVID, and extrapolate that over a lifetime. How many chances at MECFS do you have? How many tickets do you have in that raffle that no one wants to win? So what can nurses do? Helping you treat comorbidities. A lot of ME patients have POTS. I have to share this. This was, sorry, I'm backtracking because I forgot this picture. This is the event, post-event. Like, this is what it looks like. And she was like this for a week or two. I think probably most of the people at the event was. Treating comorbidities, orthostatic intolerance, postural orthostatic tachycardia syndrome. Listen to patients and look out for PDM. That's the biggest thing. You can help the doctors with that. They're not asking questions about PDM often. Questions to ask are, when you push yourself, do you feel worse 2 to 3 days later? Sometimes it's the next day, sometimes it's 3 days later. Everyone kind of has their own period where it usually hits them. When you see a patient, realize that you're seeing them at their best. Like Jes said, you've got people that are saving up their energy for weeks, months to go to the doctor. So when you see them, don't think, oh, they can't be too bad. They're right here and they're walking around and they seem fine. Because you don't see this the next day, the next week, the next month. And I would leave you with my wife's enduring optimism and impress upon you the excitement she has around the research. She's fascinated by the illness, and she hopes that other people want to get involved to continue your education and your research into this illness. It feels like we're close to something great, and we need more people to be involved in that. And that's the message she would want to leave with you. Thank you.
I'm Andrew. I'm going to go without mic because it'll just get in my way. We're the new kids. Corey came down with COVID about 2-ish years ago. And I had this big oral speech about how it happened. Like, we got engaged and we went to Mexico to get engagement photos, and we came back and she got sick and she didn't get better. I did a lot of work on that speech to condense it into 10 seconds. But we didn't know what the hell was happening. You know, and you're going to hear similar notes of Jes and Aaron via Nate. To go to sleep for 10 hours and wake up and you're not any less tired, it at times it felt like science fiction to me, you know, because everything is nominally working normally for me, but to see Core sleep for 12 hours, 15 hours, 18 hours, and not get better? That's bizarre. So that's part one. When she got COVID, I'm going to do a lot of foreshadowing, so stay with me. When she got COVID, she couldn't breathe, right? That's not, unfortunately, abnormal, COVID. But she couldn't breathe, so we went to the ER, and we were there for 9 hours, as one does when you're in the ER. And they finally gave her oxygen after about 5 hours, and it helped. Okay, now we're doing okay, right? She has oxygen. What they didn't do was a PCR test. And how that impacted is that I'm going to address she and I as we, but I freely acknowledge she has gone through this. No COVID research would accept us at all, because without that PCR test, it fouled their results. So that's nice. So about 3-4 months into everything that Jes has described, everything that Nate has described, we're going through the same thing. The COVID symptoms go away, but the fatigue doesn't, the brain fog doesn't. Do you know how odd that is, to get better but to not get better? We had seen her GP, who remains a great resource. He's been very, very good. We're starting to see specialists, and we have mixed results with these specialists. I'm going to leave out a lot here, because you may have picked up on some of this. There's a lot of anger in our community from medical professionals who have made the wrong decision in the room at the moment. It's not worth mentioning. But we start doing our own research, which is weird as patients, and we freely believe this is helpful, right? Patients should be doing some of their own research to understand just what's going on. But I come across a tweet from a very educated woman, very spoken woman named Jes Gordon. Liz, who we now count as a friend and would be here today if she could, she saved Corey's life, you know, without hyperbole. Because had we not known what the hell this was, or had some semblance of what it was, we would have gone forward with the specialist's advice. You know, you're just depressed. I'll say a word and everyone wearing a red shirt will laugh or smile. You don't have to laugh, it's a lot. You're deconditioned. See, told you. It's a joke in the ME community, the word deconditioned. Corey ran marathons. She ran a marathon 4 months before she got sick. And they said, she can't walk up the steps in our house. Well, she's just deconditioned. And I'm not sure, you know what, nothing I'm gonna say is gonna be positive, so I'm just gonna, we disagree. But we found Liz and this amazing community of people who told us you might have MECFS. They're very, very careful to not, throw a diagnosis out and get it, but this might be something that you want to look into. Don't push if you feel tired, which is somewhat counter, like Nate said. If you're working out, you expect to get better. If you're not getting better, there's something wrong. Corey and I went to the grocery. Is it okay if I tell the story? And this is before we had the wheelchair or anything like that. And we walked into Publix. Well, Publix appropriate. And we got to the middle of an aisle, and Corey's in a very small, reedy voice, I have to sit down. I'm dizzy, I'm exhausted, I have to sit down. So I got very well versed at grading. I was studying very intently so that no one would see Corey had to sit down in the middle of the grocery. That's messed up. You know, first of all, gravy is not that interesting, but secondly, to be that physically infirm in that moment. And I remember going to a nursing example for those of you in the room. We went to our cardiologist's office, and the first time we were there, and we were in the waiting room, and the nurse came to the door and said, Corey Anderson, and I said, yeah. And she said, okay. And for Corey to walk from the chair to the door, right? Let's call it, I don't know, 20 feet, this far. Took her 2.5 minutes. I just happened to know this, right? It took 2.5 minutes. And the nurse said, you know, let's get your weight. And Corey is a little tottery in that moment anyway. Got her weight, got all that. And she said, okay, let's go to the exam room. And the nurse walks at this pace and vanishes. I'm like, listen, you and I have never met. I will wander these halls calling your name. Because I think it's entertaining, but also because I really want you to understand. Actually, it was my decision, active decision, not to use notes when I watched Nate and Jes. Was like, oh God, I might have screwed up. But there was only one more. I decided I would just tell stories, right? Like things that make no sense whatsoever. Just to try and give you examples of how insidious this thing is. There is a restaurant called Cafinio in Avondale Estates. And it's fine. It's not great, but it's fine. And one night, Corey and I went to Cafinio, Greek place, and she took 2 bites. And she said, I need to go. You know, I need to go. There was nothing wrong with the food. It was well seasoned. And I don't mean like it had a lot of seasoning. I mean, it was just well seasoned. There was nothing wrong with it. But the taste fired her sensory whatever and triggered a crash. The taste of it. So that leads to my last point. Of the 73 times I've gone through this, I think this is my last point. The taste is a sensory thing. It's something that activates. And it can be screens. It can be sound. It can be smells. Like all of these things can trip that in her head. Some of our audience today are students, right? Have you guys ever studied for 4 hours at a time? Yes, thank you. 6 hours, 8 hours. And the thing is, in those 6 or 8 hours, I promise I have a point, kind of sitting like this, right? You're not chopping wood, you're not running. Okay, so hold that for a minute. Second thing, something that I had to do recently. Unfortunately, I went to a funeral. And I was, you're sitting 2 hours. You're crying. You're watching other people in pain, and that's affecting you. But then you get in your car and you go home. So studying, funeraling, you're exhausted after that, right? Like you're not ready to go and run a marathon. Why do I bring that up? When we were vaguely screened for PEM, post-exertional malaise, They asked about the physical. And that's all they effing cared. There was no mental, there was no emotional. It was, well, how far can you walk? Right? Like, okay, that's helpful, kind of. But for a medical professional to not realize how much mental and emotional things can impact the same level of stamina is an oversight. Right? I really had an excellent climax and denouement, but I've forgotten it because I should have used notes. But that said, to wrap things back up, this bottom left photo, bottom right, from your perspective, is I'm making more a United fan, which is to my own discredit. I really admit. But she can go to matches, you know, in the brightest, loudest environment possible. Because when she came down with this, coming into this building was laughable, even in a wheelchair. So to Nate's point, it can get better. And if treated properly, you can give someone back their life. I don't know how much more important something is than that. Thank you for listening and bearing with me.
Thank you so much for sharing your stories. And I think
that it came out really clearly both how much you all care about each other, which is wonderful, and how frustrating the healthcare profession can be.
And so we're here to try to learn to do better and understand better. And this is where the education lies. And until there is a drug,
there is at least caring and understanding.
So I hope that has come out for all of you.
And so if you're comfortable, the panelists would come up and see if there's any questions from the audience.
I think you really covered a lot of very clear and compelling information. I think one of the common themes is how inaccessible our medical offices can be. So if you have an opportunity to say what
could make visiting a clinic easier on you, on your family, that may be a good way to start, and then I'll see if there's other questions.
Yeah, I'll go first. I just kind of touched on it. The things that don't seem that big of a deal to you as a perfectly healthy person can make a huge difference. The beeping, if you can lower the lights a little, or even better than that, just ask. Does someone need to lie down? That's super helpful as well. Don't walk off at a very brisk pace, that kind of thing.
Yeah, I really related to the walking scenario. That was a really good demonstration. I can't even count how many times that's happened. I mean, and I'll just stop until you pay attention. Anyway, I can't really think of anything more than the lights were such a big deal for us. And I think how hard is it to have if a patient forgets to bring earplugs, to just have earplugs available? You have masks, have earplugs, even eye masks. I mean, that can make a big difference. Because sometimes you forget, and sometimes, it's hard. It's just I even noticed that just putting in one earplug in, you'll see a lot of us doing that. That makes a huge difference to be able to handle and tolerate the overstimulation of the environment. So, and the laying down, that's important.
And I know my wife is always cold when she goes to the doctor, so she's always asking nurses for blankets.
Cold.
I mean, I think that there's like mind-body stuff to be aware of, but for far too long, we answer to mysteries or diseases. When we don't know the answer, we blame it on the patient. So I always think that we have to be really careful about patient blaming, that like, hey, you can heal yourself. I call it being celery juice. I can't tell you how many times I've been told, try this method or this thing or this meditation. I have done the brain retraining, 2 different programs, 2 times in my lifetime. It did not get me out of bed.
Yeah.
And I think so. It's like, I think there's definitely some reality to the vagus nerve. I take stuff to calm my vagus nerve. This morning I woke up, because I did so much yesterday and I did so much on Sunday, I woke up and I couldn't sit up without being dizzy. I did a bag of saline, I took hyoscyamine, it calmed my vagus nerve, I could eventually sit up. And I do this thing when I'm laying down where I like kick my feet and my arms while I'm laying down to get my blood flowing before I sit up.
Yeah.
You know, and it's like, there are some things I can do, but you know what I would rather? I would rather something to combat PEM. Can I have a drug for PEM, please? That's what I'm asking for. And I know that that's what all of my friends who are stuck in bed and people who are on the live stream right now, we are live streaming, you know, that they can't get here. They want something to combat PEM. That's what we're asking for. And I don't think it's a lot to ask for, because we've all tried. We've spent thousands of dollars on those programs. Treat yourself. You can heal yourself. Blah blah blah. And I mean, not to.
I want to respond when you're done. I don't want to interrupt you.
Yeah, but I'm just saying that, like, I think we've got to be really careful about the patient blaming that can go along with that. That's all.
I think
The community needs hope, and
the attention that long COVID has brought to
the fact of these post-acute chronic illnesses that are poorly understood is really important. And the research community is, I think, really struggling with how diverse these conditions are.
and how heterogeneous. And I think the patient stories of
What has helped one person may not help another person. I think that's perfectly clear from the patients themselves.
and their stories.
But it is also clear that having a community has been very helpful to understand, to get around a group of people that are very understanding.
Of what you're experiencing.
I think to that end, and something I was trying to dovetail into the previous comment, was that if Corey and I had to choose, and I can't see you, but tell me if I'm wrong, if we had to choose the benefit that we have accumulated from physicians versus the benefit that we have accumulated from MEAction, we would take the latter every time. You know, better research, better treatment. Yeah, it's true.
The patients that COVID Alliance and the Patient-Led Research Collaborative have been
Leaders, and I honestly have never worked on an illness where so many people involved in research and the clinical care are impacted by the illness, either themselves or in their families. And you know, we need to change that, and that's why we keep, you know, doing our best to educate and make sure that the word gets out.
If it's okay, I'd like to change
To another QR code. We can come back for, and this is for the students. This is some educational, these QR codes will take you to some educational materials.
I'm so sorry to interrupt. That is going to really not be good for the patients in the room. It's a little too bright.
Yeah.
I don't know what to, So,
Can you turn the brightness down?
Contracts.
you know what?
Sorry. Students come down afterwards and get these QR codes. We're gonna go back up.
Remember when I talked about the well-seasoned Greek food? It's that kind of thing. The things that you don't
Yeah, don't-
really think about that just like, oh God, and
Sorry. Okay, it's not.
There's a reason we
But
picked
those,
the background one.
one of them is an article, a really great continuing medical education article that was co-authored by an MEAction advocate, and it's just excellent. It's really, really
And of course, then some of our websites, we do think people are helpful too. So I think that,
Any other questions? Well, I would like to thank you so much for your participation.
the voice of the patient is absolutely what we need. And you really cannot treat this illness or study this illness without talking to the patients. And that's a lesson that we all have to keep in mind. So thank you.